name is Darryl Rattray. I'm the ambassador of the Sigma Beta Beta chapter of the Omega Psi Phi Fraternity Incorporated. I want to welcome all of you to tonight's discussion. Let's talk about the vaccine. We started the discussion series because our communities have been devastated by this pandemic, and a large part of the problem has been misinformation about the facts. So we wanted to create a platform where you can hear experts speak about the topics, give their experiences, and answer any questions you may have. We received a lot of positive feedback. So thanks to all of you that shared the information from the last session. Thanks to all of you that invited people to this discussion this evening. And of course, to all of you that shared the flyer for tonight on your social media. We appreciate all of you. Thank you for helping get the right information, the facts out to our people. Tonight's discussion is about the vaccine, which is all on our minds. Many of you have sent in questions, but please feel free to put any additional questions into the chat. So without further ado, I'm going to turn it over to our host and moderator, Brother Jason Rivers, who will introduce you to our panel and get the discussion rolling. Brother Rivers.
Thank you, Brother Rattray. Good evening, everybody. Welcome to Sigma Beta Beta as we talk about the vaccine. So unfortunately, when I look at the number of people, we're at 100 participants, which is amazing. The sad part is we probably can triple the number of people that we all know that we've lost to COVID-19. Unfortunately, everybody on here probably has had a friend, family. Many of us from our illustrious fraternity have lost brothers to COVID-19. So as we talk about this vaccine, we started this series, as Brother Rattray said, and we started it and we'll continue it because we want to make sure that we're getting out all the information we can to the public. So I'm going to jump right into introducing two brothers who are going to be really heading the discussion as we talk about different topics that have been sent in. So thank you to those who have sent in your questions. We compiled your questions and condensed them and brought it on as topics so that both Brother Jadan Phyllis and Brother Watson can talk about this. So Brother Jean Baptiste Watson is a family nurse practitioner with extensive experience in family emergency and urgent medical care. Over the past 10 years, he served as patients in the emergency department at Bellevue Hospital in New York and other standalone urgent care. So Brother Jean Baptiste Watson is one of the brothers that is going to be talking on the panel. And our other brother is Brother Dr. Jadan Phyllis, who's the medical director of the Stony Brook University Home Clinic and also Associate Dean of the Stony Brook University. So please welcome these brothers as we start to begin this conversation. So the first thing we wanted to talk about based on a lot of the conversations and questions that came in was basically the type of vaccine. So Brother Phillips, I just want you to start us out and kind of introduce yourself, brother, and then jump right into the type of vaccine and what's the differences between these vaccines.
Well, good evening, everyone. Again, bros, thank you for the opportunity. I think this is a critical topic. So,
Jadan, unmute yourself and continue.
Again, this is a critical topic at a critical time because we are entering what they are forecasting to be the most dangerous time thus far of the COVID pandemic. My background is I am a graduate of Johns Hopkins University. I went to University of Maryland Medical School. I am a family practitioner by trade. Did my residency at Stony Brook Medical School. I'm on the medical school faculty, associate professor, and I'm an associate dean of student and minority affairs. Within the Omega Psi Phi fraternity, I'm the second district health and wellness chairperson and on the vice chair for the International Health and Wellness Committee for the Omega Psi Phi fraternity. Also, and pertinent to this conversation, a member of the COVID-19 task force. Omega Psi Phi has been involved in this pandemic from the outset. We have recognized that we have been a community, those being Black and brown communities, that have been the low-hanging fruit as far as our susceptibility to the mortality and morbidity of this pandemic. Also, we have seen that our health circumstances, which aren't always what we choose, but I feel that racism and disparity and social, inequities also play a great role in our health circumstances. And in addition to that, we are a community that does not have access to quality medical care as a whole. So what that has made us in this pandemic as is the low-hanging fruit. So again, this pandemic has been something that has been increasing. And as we've gotten to the holiday season, we have seen the numbers go way above what we thought was bad back in March and April. So we are at a point that is probably 2 to 3 times what we saw then. And it looks like things may be getting worse, but we do have some hope here in the form of the vaccine. So I encourage all of us to think about it. Now, to answer your question, Jason, about the 2 types of vaccines, the 2 vaccines that we have available right now are both mRNA vaccines. Now, what is an mRNA vaccine? mRNA is a DNA derived. Now, just because I was a kid that played with toys, I had Legos. Now, if you look at Legos, each individual Lego is a piece of DNA. You can, with that DNA, create something, and that something is mRNA. And what mRNA does when it gets into the body is it is able to direct things. It is a person, like my wife is the person that says, hey, put this there, put that there. And that's sort of what mRNA does. And when it gets into your body, it instructs your immune system to develop antibodies and immunity for the COVID virus. Now, the specific area of the COVID virus that it is targeting is what they refer to as the spike protein. The spike protein, if you've seen an image of COVID, is the horns on the surface of the virus. And through those horns, the virus is then able to connect to the cell. And when it does connect, that is when it's able to cause its damage. So the mRNA directs our immune system to form a reaction against that spike protein, thereby preventing the COVID virus from attaching to the cells and preventing that connection. Then the COVID virus is not able to cause the destruction and death that we all know too well that it's been able to do. So you are not getting any live virus. You are actually getting something that's going to instruct your body or your immune system to form a reaction. So the differences between the virus, or the vaccine rather, is in terms of some of the storage and handling details. The Pfizer vaccine is one that needs to be stored in a colder temperature. They recommend anywhere from -80 to 120 degrees Celsius. The Moderna is a vaccine that can be stored more in circumstances that are conducive to the type of refrigeration that we might see in a doctor's office or in your local pharmacy. So I had received the Pfizer vaccine, and as people said to me, yo, son, I want to make sure I get the same vaccine that you get. I don't want to get the Moderna. I would have taken the Moderna if that was the one that was available to me, but because I work at a hospital and the fact that the hospital has these larger storage capabilities, that is why the Pfizer was the available vaccine for me. The Moderna is one that has an easier means of storage. So that means that logistically, it would be a vaccine that is more readily available to the community at widespread. And that means that it is something that would probably be available at your local Department of Health or at your local pharmacy or things of that nature. The other differences you might see are the Pfizer is a 21-day interval between the first and the second shot. The first shot, the purpose of it is to prime your immune system, which is it is going to cause your immune system to start to recognize the COVID spike protein and produce COVID spike protein antibodies, which would help you have an immune reaction to it at a later point. The second vaccination of the series is a booster shot, which then gets your immune system up to the level where it can, and this is what the vaccines do, prevent serious disease. The vaccines don't necessarily prevent infection, but they prevent serious disease, meaning you won't get admitted to the hospital. And unfortunately, as many of us know, getting admitted to the hospital back in the earlier part of COVID was a death sentence. So the vaccine prevents serious disease. But that's a key point because, again, when we talk about, you hear people saying, do I just take the vaccine, my safety precautions, do I abandon them after I've gotten the vaccine? No, you can't be like Hank the Tank in old school. You still have to wear your masking, still observe the safety parameters, because theoretically you could get infected with virus that won't necessarily make you sick, but you can infect the next person. Side effects, local swelling or local inflammation in the area has been one thing that has been shown. Other than that, some mild febrile flu-like symptoms over the first 24 hours. Other than that, there's been no statistically significant side effects that have been recognized.
So that's one of the concerns with people have been the vaccine. So you getting one vaccine, where if I get vaccinated, I get the other vaccine. So there's no difference other than just saying the refrigeration between the vaccines. Is that what you're saying?
Well, the other difference, and this is a milder one, Pfizer, I believe, has a 90% effective rate. Moderna had a 94.5, but those are really the major differences, that people are looking at when they're looking at contrasting the two.
Right. So if I'm scheduled to get the vaccine, is there a way to ask for one and not the other? Or is it just wherever you're getting the vaccinated at, you just have to go with that vaccination?
As somebody taught me at a young age, when you got show and you trying to get mo, you might end up with no. So if you are offered the COVID vaccine, Pfizer, then you take the Pfizer vaccine. I've heard some people say, I'm waiting for Johnson & Johnson. COVID is still out there shooting bullets that are coming closer and closer every day. So how much longer do you think, if you've been fortunate up to this point and you're a person that has family that are visiting, like many of us, many of us live in multi-generational households where you might have a grandmother living with a grandchild and everybody in between all in the same house. So again, with all of those different individuals doing their thing, how long do you think you can go out here, and with these more infective strains that are out here, that are causing it to be easier for a person to get infected with COVID, how much longer do you think you can go and avoid it? And if you've had it before and you had it in the earlier part of the year, don't think that you can't get it again.
So with the vaccine, there's not 100% that you won't get COVID. It's just not out there. Is that it? You can still get it.
There's very few 100% in life. So,
right.
No, it's not 100%. It does 90% prevent serious disease, 94.5% with Moderna, serious disease, but you can theoretically get infected, and you won't, with that 90 and 94.5%, you would have avoided serious disease, which is what we should all be striving.
Right. Brother Jean Baptiste, I'd like you to jump in on, so a lot of concern has been about this vaccination was created rather quickly than other vaccines. So I would like for you to really talk about that.
Good evening. I'm Watson Jean-Baptiste, and I am a family nurse practitioner. Initially, I was not a clinician. I did study political science, aspired to become a lawyer, but I had a high passion for healthcare, and I decided to follow that route. And I became a nurse practitioner. I went to Pace University to become a nurse, then become a nurse practitioner a few years later. I spent most of my years as a nurse practitioner doing prison health, emergency medicine, urgent care medicine. In the years of Ebola, I worked in the emergency room at Bellevue Hospital. And I also work in the emergency room at St. Joseph Hospital in Yonkers, New York, where I was the director of the emergency room, and I had to handle patients and staff dealing with Ebola. Now it's COVID, and I'm here doing the same thing. It started with me at the urgent care. Now I am doing geriatric in a couple of nursing homes in New York. And this is a very fragile population. This is a population at risk, and then we are vaccinating them. What we are seeing right now at the nursing home is that patients are doing better, and some of them develop symptoms after receiving the vaccines, like fever, mild runny nose. But we have not had any fatality because of vaccination in the nursing home. I know there's been some articles out there, some videos about the elderly receiving the vaccines and died in some of the places around the world. Well, we haven't been having these cases. And what I'm finding out as well is those patients who died in Norway, for example, were critically ill patients. So it's very hard to establish a connection between the vaccine and death, because those patients were in most cases terminal, and they ended up dying after receiving the vaccines. It can be just there's no correlation, and science is still looking at it. So we cannot say that the vaccine caused them to die. So the vaccine rollout, of course, we know it's not the best right now, and we have a lot of healthcare workers who really need to be vaccinated, and some of them missed the boat. So first time around, a month ago, vaccine rolled out for healthcare employees. A lot of us in our communities refused it. Now, a lot of us want it, but it's not available because we know in New York we're running low on supply, and at some places there's no supply at all. So part of the scare about vaccination and this COVID vaccine is that what I'm finding is even colleagues I work with, or it's been developed too fast. It takes so long to develop a vaccine. Well, here's what I tell them. There is economics of vaccination and economics of healthcare. So we're living in a world where supply and demand matter. So if there's no demand for something, we don't produce it. Companies like Pfizer, Moderna, Johnson and Johnson, they invest a lot of money in R&Ds, which is research and development. Their own money into developing medication, whether it's cancer drugs, whether it's HIV medication, whether it's vaccination. They invest their own money into it, and it takes time for them to invest a big chunk of money because they don't know if it's going to work, one, and they don't know if it will be approved by the FDA, by the government, two. So when you have a company investing money in vaccination, it's a risk. So about 6 or 7 years ago, under President Obama, there were some efforts for a COVID vaccine. We made great strides, and for some reason they stopped. Well, part of it was because the government was not investing tons of money into it. Well, with this administration, the Trump administration put in $2 billion into making the vaccines. If companies get that kind of money to develop vaccines, they will develop vaccines every month or every 2 months. So what makes vaccine last so long to be available to us is because research and development is not a fast process. Companies have to invest their own money and take the risk and don't know if it's going to work. So when they finally have enough money, every year they drip some money into the research and development. When that's available to create the vaccines or any medication, then they have to conduct trials. That takes a long time. That takes money. For the COVID vaccination, when we combine the research subjects who took the vaccines or who took the placebo, we're looking at over 100,000 people. It's all because the federal government invested so much money into it. That would not have been possible if there was not so much money invested into creating this vaccine. We will still be looking at 4 or 5 years to really get some kind of a first dose to anybody's shoulder if companies were the ones investing by themselves into this, to create a vaccine into this pandemic. And it's going to get even better because with the Biden administration, we are already seeing executive orders in these directions, forcing companies to really make themselves available or developing machinery to create more and more vaccines so we can put the pandemic behind us.
So what you're saying
So
is it's not that it's not that you're saying it wasn't rushed. It's more about there was more money quickly put behind this vaccine because of the number of deaths that were occurring. Is that what it is?
That's correct. And supply and demand. So now there's a high demand for the vaccine, so companies will make it. So if there was no pandemic, if there was no COVID-19, okay, companies will not venture into investing hundreds of millions of dollars into creating a vaccine for it because there will be no demand for it. You can have a stockpile of vaccine and no one is buying it, and it can all go to waste. So this is different. So some people might say, okay, well, for human nature, for the safety of humankind, companies should go and create these kind of medications or vaccines just in case. It is true, but if they're going to do that by themselves, they can also go bankrupt because
So what's the age? What is the age actually for the vaccination? For example, what is the age what's the minimum age that they're going to allow people to get vaccinated?
now we're looking at 16 and older, and I think in some instances they're talking about 13 and older. So we don't have a vaccination yet for the younger kids. So in other words, we're still going to be behind the curveball in terms of achieving herd immunity, which will require that we have at least 70% of the population vaccinated or immune in order to get rid of this 100%. But there's not enough vaccines for every single 16-year-old and over to be vaccinated right now.
Mm-hmm.
So that's probably why Joe Biden invoked the wartime kind of executive order to see if we can have companies to develop machinery to just create more and more vaccines.
So people who take the vaccine, are they resistant to COVID, or are they less contagious to others?
Well, it's exactly what Dr. Phillips said earlier. And if you take the vaccination, you basically put behind you all these severe comorbidities that you're dealing with. So, for example, I'm in the nursing home. We tend to believe that the nursing home is for older people. They all old and they all full of diseases or incurable condition. Well, that's no longer true. Some of my patients are 37 years old. Some of them are 43 years old. Some of them are 46 years old. And they had COVID last year and they're still having a hard time to walk. They cannot walk because COVID was so severe. COVID left them with kidney disease. COVID left them with heart disease. COVID left them with neurological problems affecting their limbs, affecting their ambulation. And then somebody who was a very successful professional at 37 is right now home on disability for nearly a year now because that person cannot walk. And somebody who was home living on his own or on her own is now in a nursing home because that person is so debilitated by COVID-19, has some kidney issues, and cannot even take care of himself or herself, is in the nursing home. So with the vaccination, we can avoid these conditions. We can avoid the kidney failures. We can avoid the severe heart disease that come with it. We can avoid those long-term hospitalization leading to poor circulation in your limbs, ending up losing your toes, then your foot, then your legs, because you develop so many clots and gangrene to your limbs that they have to be amputated. All of that comes with COVID.
Right. So Brother Phillips, Dr. Phillips, I'd like you to jump back on. So these series of concerns that have been brought to the floor deal with getting the vaccine and how it relates to certain things. So how does it relate to wearing a mask? Is that something everyone should still do even though they get vaccinated?
As I stated before, the vaccine just prevents you from getting serious disease. So what that means is you could theoretically be infected with COVID and you may not be the one that gets sick, but if you go visit your grandma who's not vaccinated, you could give her COVID. So you should still wear protective equipment, face masks, wash your hands, watch your distance. So all of that should not be abandoned just because you're vaccinated.
So one of the questions that's come up has been the opening of restaurants, businesses, and actually getting our kids back in schools. Is this something that the vaccination will assist with?
Absolutely. I think us getting back to a more normal way of life is more possible with the vaccine. You know, Dr. Jean-Baptiste mentioned about, just reaching that point of herd immunity. That's what we would like to get to. That's where 80% of the people are either vaccinated and or, have had COVID. That puts us in a place where the society can now be safer. And I think, to those things that you mentioned, going back to school, whether it's our kids or our kids in college or kids in high school or younger, businesses opening up. If we want any of those things to happen, we got to participate in it. Because if we just let it be, the numbers are going up. Yesterday, this week, we over 400,000 people dead. And we've actually doubled the amount in the past 3 months. The amount that it took us almost a year to reach, we've almost doubled that in 3 months. So that means that we are in the acceleration phase of this virus and pandemic. So again, if we want to avoid that, because if you do nothing, it's not going to get any better than it is. It's going to, in fact, get worse. So I think, again, those things that you mentioned are definitely impacted by, this vaccine. And going back to what was mentioned earlier, as far as with our children, again, right now, we only have vaccine that is recommended for people over 16. There is still research ongoing to determine when younger age children will be candidates for the vaccine. Hopefully this will be before the school year beginning 2021. But what we can do is the adults can get vaccinated and create a safer space for our children. Again, some people might say, well, why do the children are not the priority? For the most part, the children have not been the low-hanging fruit. Even though we've had some cases where children have died, there have not been the majority of cases. The majority of the more serious cases tend to be with our older individuals and with those that have significant additional medical problems, such as heart disease, such as diabetes, such as previous stroke, such as lung disease, such as obesity.
Okay, so go ahead, brother. Go ahead, brother. Dr. Jean-Baptiste, go ahead, sir.
I just want to add is we also have our urges. So our natural tendency is to go back to what we used to. We are all creatures of habit. The habit of going out to a restaurant, the habit of going out to the gym, the habit of let's reopen school. Well, we've seen those examples in the past few months. We've seen the rush to go back to a normal lifestyle has caused us to really have to worsen the condition. It really, if you look at New York and California, how bad it was last year, it's closing in to the middle of the country. It has closed into the middle of the country, and now the whole country is infected. So we really need something to be done, and the only way so far we can do it is to mask up and get vaccinated.
So that brings me to a point I want to ask the both of you a question, because one of the things I've constantly heard a lot of medical professionals are not getting the vaccine. So it's hard for the general public to think of the vaccine as safe when you have a good amount of medical professionals who are not. What's your thoughts on that?
Well, all the MDs I know, we getting it. I don't, I find sometimes it might be some additional folk. I found a lot of nurses. I found other people that are more, the other accessory people that are part that have been those. But at the end of the day, I trust my over 20 years of education and over 25 years of practice. I trust the science. So at the end of the day, as we say in Queens, you got to hold that. If you want to not get the virus or the vaccine because you don't trust it and you've gone to school and got a medical degree, I hear you, but I also understand. As we mentioned earlier, there's been a lot of situations that have created this distrust that people have had and that people currently have. However, that's what COVID is taking advantage of. And COVID don't care if you got the most righteous reason. If your grandfather was a part of the Tuskegee experiment, COVID will still get you. You know, doesn't matter if you've been drinking alkalinated water, vitamin C, elderberry, doing all of those things that do boost your immune system, COVID could still get you with all of that on board. So I personally have been one that believes in the vaccine. I got the vaccine, not just for me. I got it because I want to protect my family. I've got it also because I want to be an example. I want to be the bridge builder. I want to be the guinea pig for y'all that are nervous. You know, because again, the reason I got into this was because of the things that people are suspicious of medicine for. And the reason that I got into this was so you'd be talking to me, not to the person that you feel that suspicion from. So at the end of the day, I trust science. I went to school for a reason. You know, I trust it. So that's my answer, sir.
Well, I want to add something to this. It is true there are a lot of health, there's a lot of health professionals who are not taking the vaccines. So I cannot talk personally for anyone or their reasons not to. I respect the reasons behind their decision. However, the same way we have the freedom to refuse the vaccines, we also owe that same freedom to somebody else by not getting somebody else contaminated. So if we choose not to take the vaccines because we feel like we have that freedom, which is true, we should also respect that grandma and grandpa have the freedom also not to catch it from you. So if we not willing to do it for ourselves, we need to think of others. We are each other's keeper in that sense. Do we go on and refuse it for ourselves and get it and have no symptoms or mild symptoms, but get our parents, our grandparents infected? I think it's something that we should think about.
Right. So let's go to anybody's concerns. So we have people who still have antibodies left. Do I still need to be vaccinated? And the second question part of that is still having antibodies. Will getting the vaccine kill off a person's the immunity?
Well, with the immunity, if you've had it before, you know, if you've had a mild infection, they say at most you might have 3 months of immunity. If you've had a more serious infection, they say it may be 6 months. So theoretically with that, if you had COVID in March, you fair game right now. So that immunity really is not something that I would bank on. Usually one of the contraindications to getting the vaccine, currently the COVID vaccine, is if you've had a COVID infection within the past 90 days. So you would need to be 90 days out of that. But after that point, I would definitely recommend that, you know, get your vaccination, because I would not bank on the previous exposure being the same as when we were younger and my mother sent us over our cousin's house because all of them had the chicken pox and then we got the chicken pox. I don't think it's like that.
Okay. So if a person has COVID in July, should they ask for an antibody test before agreeing to be vaccinated?
I don't think so.
It's not important.
It's not important.
The science doesn't give us anything significant behind this, because even if you have some kind of immunity and you had it in July, we're in January. You're out of that. A lot of my patients are having it for a second time, and they were very sick back in July and August last year, or even in March or April last year. Colleagues I work with were very sick, missed weeks of work because of COVID. They have it again.
Right. So a person who's had COVID, do they have a strong immunity to COVID, or does it work the opposite way if you had COVID already?
What do you mean as far as getting COVID again?
Yeah.
Again, like I said, if you have had it, you were mildly affected and you got exposed to it again 3 months, you might not get sick. If you had a more serious infection and it was 6 months, you know, within that period of time, you might not get sick. But if you had COVID in March whether it was serious or not, and we're talking now January the next year, I don't think that immunity is really going to help you out. Now, there may be one or two people, but I wouldn't want to take the chances to roll the dice on it just being one of those few.
So has there been anything so far as side effects that have come about from the vaccine? Have people reported any type of side effects other than, I know you get the shot in the arm and it hurts at that moment. So, I mean can both of you tell your experiences on that after both of you have been vaccinated?
I mean, I had the Pfizer shot. I got one shot. I had some soreness in my arm the first time. The second time, I had some similar soreness. And, I was a little tired, but I went to work the next day. In addition to that, I still did my exercises as I always do every day. So I didn't feel anything that would take me off my regular day-to-day.
Baptiste?
I had the Pfizer shots twice. Did not get sick. Did not feel any pain. I had a little soreness in my arm for the same day of, and I went to the gym, and it went away the next morning. So no runny nose, no fever, no body aches, no other symptoms, nothing from me.
Okay, so for those of you that have put questions in the chat, I'm going to try to get to as many as we can. So what we've discussed so far has been what the questions that were sent into the chapter previously. So for some of the questions that are here, we've covered some of them. One of them has been the both of you have talked about the age. So the age you're saying is right now is going to be is 16 right now. They're still doing research. Is that what it is for younger ages?
Yeah. So pediatrics there's been no approval for any dosing or vaccine for children less than 16 years old.
And the science behind that is because children don't have their organs fully developed until they reach a certain age. By 16 years old, the organs are fully developed. So we don't have the research yet to say it's safe for kids lower than that age group.
Okay, so one of the questions from the chat, people have allergies and allergic reactions. From what I've heard from the news, allergic reactions are increasing. Is there any data or studies that show it's safe for people who have allergies to get vaccinated?
I would say, number one, there are people that have allergies to vaccinations, whether they're COVID or not. So that's something that's common. And in the individuals that we've seen, some of these vaccine reactions, they've been people that have a historical vaccine allergy. So we don't even know if that's related to the COVID vaccine. It could be the same reaction that they get with the flu or the shingles or the pneumonia. So that is, something that can happen. In addition to that, excuse me one second. My son is popping on me. I apologize. But again, for milder vaccine or allergies, with me, I'm a hay fever person, and I also have a penicillin allergy, and those types of allergies were not something that was contraindicated for me to get the vaccination. So individuals that have a significant history of serious allergy, meaning you're a person that might have an EpiPen, or you're a person that has had serious allergic reaction to vaccination in the past, you definitely would be someone that you want to check with your doctor to make that decision about whether or not you should get the vaccine. Those are one of the groups that are cautioned with getting the vaccine right now, not because of the COVID or the COVID vaccine, but because of their history of having serious allergic reaction. There's been some report of Bell's palsy, again, not statistically significant. And again, Bell's palsy is something that can happen, or not a frequent, but can happen with other vaccines. So again, some of these reactions that have been mentioned have not been statistically significant. So if you're telling me that 10 people out of 2 million had a reaction, and you're telling me I could either avoid that or deal with COVID or go with that risk, I'm gonna go with the 10 out of 2 million risk. I think that's a better chance than, unfortunately, dealing with the realities of the dangers of COVID.
Okay, so another question. My question has to do with the studies that have reflected that particular blood types are highly resistant to the virus. If that is the case, what impact would taking the vaccine have in such a case?
Well, there's been no statistically significant studies that have said that you are afforded protection because of a certain blood type. Now, again, maybe there's some anecdotal, some stories here and there, but with the unpredictable, serious nature of COVID, I would not use that as my main, that would not be my big joker. That would not be my big joker because that is not going to save you. So there has been nothing statistically significant. Watson, I don't know if you want to add on to that.
Yes, and those anecdotes mention type O individuals. Well, I am type O. Am I that lucky? I don't know. We don't have the research yet to say really individuals with a certain blood type can really stay away, can really not get infected by COVID. We need more time to really see that. We need more time for research. The same thing, I've seen videos about ivermectin, which is a medication that we tend to use for patients who develop scabies. Well, there's been some report that this medication is highly effective against COVID-19. Well, we have not seen solid research yet. So we haven't had those double-blind studies to really convince us that science is 100% behind it or science is 95% behind it, therefore we can use it. So we're waiting for that. It's the same way the COVID vaccination, there are some long-term unknowns about the vaccination. So we are hoping as we go along, we get to know better about COVID vaccination. So the mRNA technology is not a new technology. It's been around for a while. Cancer patients, for example, get immunotherapy. Patients who are not qualified for chemotherapy get immunotherapy. Immunotherapy is mRNA science, basically trigger the body to develop some kind of reaction against the cancer cells. So it's the same thing this vaccination is doing. We know that immunotherapy is safe, so research is needed to really tell us more.
All right. So another part of that question is, I've also read that protection from the virus is actually only a period of 4 to 6 months. If that's the case, will there be sufficient doses for individuals to retake the shot 3 or 4 times a year?
Well, I haven't heard anything with the vaccine being so short. It's been at least, a year, 2 to 4 years is what I've heard. So it may be like what we already do with the flu shot. We get a pneumonia shot every 5 years. So I don't think, having multiple vaccinations is something that's new to us. So I don't know why we need to be, alarmed by that fact, because we already are doing it for other conditions like the flu and shingles vaccination. That's 2 shots.
So will this vaccination have to be done every year?
We don't know yet. Again, as Watson said, we're still gaining information from it, but what we do know now is that you won't get very sick with it. And I think that dealing with this pandemic is a certainty that we need, because unfortunately we have seen, again, you get admitted to the hospital. For some people, that is, I'm never going to see that person again. So again, taking that off the table, I think is a major, major factor with it. So if we got to get the shot every year, if we got to get it every 2 years, you get the flu shot.
Okay. So what will happen if you take the booster shot later than the 21 days if they don't have the second dose available? Because what's running into people is what's happening is they're taking the first shot, and then because they're running out of the second one, some people are going past their time. What happens if you're going past this time based on this question, if it's 21 days and they don't have that second dose available?
Well, what's about to happen right now is with the new administration, there's going to be an emergency order to put the federal government in charge of the distribution of vaccine. Prior to this, what we had seen was the federal government got vaccine to the border of the state. Once inside the state had to use its own resources to get it from that point to the point that it gets injected into your arm. So that exposed, unfortunately, the logistical limitations and shortcomings that we had. And I think, again, that was reflective of the previous administration. I think with this federal takeover of it, we're going to see a more generalized, structured approach that is going to be much more effective, widespread. So I do not think that we need to be concerned about that. I think within the next week, you're going to see an abundance of vaccine become more available, thereby making sure that everybody gets their second shots when they're supposed to. And we don't have to do some of these other things like wait a prolonged amount of time or mix and match doses.
Okay, so there are new strains of COVID that are out. So, you know, one of the things that people are scared about with the new strains that they keep hearing about, is the vaccine strong enough for the new strain that's out right now?
With these new strains, the vaccine has not shown to not be effective. I think the key thing to recognize with these new strains is that these new strains are much more infectious, which means that even with the safety measures that you're taking now, there's a chance that with all of that taken into consideration, you could still get COVID. So with that being said, the chances of you getting infected are going up because it's much more infectious. So I say again, how much longer do you think you can go and not get it? The way to protect it at this point from these more infectious strains is to get vaccinated.
And with these new strains, we're looking at actually doubling the speed at which someone gets infected. So basically, if we're looking at an infection rate of, let's say 100 persons per 100,000, with the new strains, you're going to get about 200. So this increases, or at least 150. So
Okay.
The new strains are looking at about 50% more infectious than what we have right now.
So another question in the chat, is there any chance that the vaccine will cause infertility?
There's been nothing that has demonstrated that it will affect your DNA, that it will cause infertility. There's been nothing that's been shown.
So if a person is tested for the virus after taking the vaccine, will they test positive?
They could. I mean, again, it takes anywhere from 10, maybe 21 days after you get the shot, the second shot, to get full immunity. And as I said, firstly, before, the vaccine prevents serious disease. It doesn't prevent infection. The other thing is to recognize that the immunity, because we had a story a few weeks ago about a nurse who had just gotten a vaccine and then got sick with COVID. It takes 10 to 14 days to get, full immunity level. In addition to that, we don't know if that nurse was doing something that they should not have been doing right after getting vaccinated, so they could have put themselves in risk. Or better yet, what if they were a person who was asymptomatic? Because as we know, it takes anywhere from 2 to 14 days on average for people to develop symptoms. So say if you got exposed a day or two ago and you don't demonstrate symptoms to day 5, 6, but on day 3, you went and got the shot.
So another question is, how could there have been an effort to create a vaccine for COVID-19 during Obama's administration and before the pandemic? I'm not really sure if the two of you are able to answer that, but that's the question in the chat. I'll say it again. How could there have been an effort to create a vaccine for COVID-19 during Obama's administration before and also before the pandemic?
Well, again, supply and demand. So it's not that there was no efforts to create a COVID vaccine during the Obama administration. There's been efforts all along during the Obama administration and possibly before him, because we had the MERS outbreak in Saudi Arabia. Those are also COVID-related illnesses. So there has been efforts to create vaccinations, but again, here we never had this, had demand for it, and the Pfizer's and the Johnson & Johnson of the world, they were investing their own money into creating vaccines. So at some point, if there's no demand for it, companies will invest money slower, or can abandon the project and resume it later when there's more money to do it. So I think worldwide we've been making efforts to create vaccines for these conditions, but the demand wasn't there for it. One or two, there hasn't been enough money to make it happen.
I
Another
think
question.
also
Go
to
ahead,
add
brother.
on to that,
Hmm.
this technology is not new, as Watson said. I mean, this technology is used with other types of treatment, like cancer treatments, have used this same mRNA technology. In addition, other vaccines like the influenza, but not on this scale, have utilized this technology in the past. Another benefit of this technology is its ability to be mobilized in a pandemic, which made it perfect for what's going on now. It was enabled us to produce vaccine at a much more rapid rate at a high level, which is what you need when you're dealing with a pandemic.
Okay, I'm gonna go to one of the questions that's been in the Facebook Live, brother Ratcher. You want to ask that question that's been posted on Facebook?
That's correct. And we have quite a few viewers watching this on Facebook Live. One of the questions that came in is, what are your thoughts on patients who are anaphylactic to food? I have been informed that as long as a patient is not anaphylactic to any component or ingredient in the vaccine, they should be fine. Lastly, are the details of the ingredients of the vaccines being shared?
The ingredients are being shared. You can, pull up the, it online. It's available. Again, if you're a person that have anaphylaxis, I definitely don't think you need to be getting your answer online with us tonight. I think you need to be talking to your doctor. So again, whatever we say, you still need to make sure that you're talking to your doctor. Anaphylaxis is a serious allergic reaction. So that means that you need to proceed with caution, and caution means that you do the appropriate investigation. So I would tell you, as the doctor here tonight, that you need to make sure you check in with your own doctor about this, because this is not an answer that you just want to grab off of a Facebook Live event.
There's one more I have queued up. It's around, I'll read the question as it's stated. I know there aren't a lot of cases of very immediate side effects, but what do you know about long-term side effects? And it's referencing, I've seen articles that suggest that the vaccine can lead to HIV. And there was a huge social media, for now talking from the question, there was a huge social media posting sometime last week that someone tested positive for HIV after taking the vaccine.
Well, I have seen nothing that says that HIV is associated this that is medically significant. There's been no data. I mean, think about it. Say somebody gets their vaccine, just like somebody may take HIV medication, PrEP medication, and think they don't have to use a condom. So, I'm not to say that someone being reckless with unsafe behavior couldn't get exposed to it, but there's been nothing that says that the vaccine has any way contributing to the development of HIV.
So one of the questions also has been the size of the needle to give the vaccine. Does it matter the size of the needle? Person in the chat has a question of, they've seen different sizes of the needle. So is one size of the needle better than the other?
When I administer vaccine regularly at my hospital, and initially what they gave us was these large needles. And again, there's nothing wrong with using a larger needle. The problem is sometimes you might not be able to get the full dose. So therefore you might have some residual vaccine in the needle. So I find that the smaller needle is actually a little better because it's a little less traumatic. And, again, you're more likely to get your full dose, but there's been nothing saying that you have to use the smaller needle. The larger needle can work fine just as well.
Okay. Another question is, I received the VidVac 1 and soon I'll get the VidVac 2. Will I be susceptible to contracting COVID again, or will I have to be vaccinated yearly like the flu shot?
Well, again, we're still learning about that. We're still learning that. That's what the data is still, that's being gathered, is still trying to determine if this will be something like the flu shot. Will it be something less frequent, maybe like the pneumonia vaccine? We don't know yet. But what we do know is that it prevents serious disease. And if you don't do anything, the alternative, which we already know, which is COVID and what it can do, is not a risk that I think is acceptable.
One question that came in is, why have pharmaceutical companies been waived from all liability for any side effects?
Well, any medication you take has this warning, even if you take a couple of Tylenol. So it's the way to practice medicine. If a surgeon is about to perform surgery, that there are risks, and the surgeon will explain those risks. So the patient will make a decision based on the fact that these surgeries have been successful 99% of the time, but there's a 1% risk that you can bleed, and so much bleeding can lead to death. So every single pharmaceutical companies have the same kind of practice. It's there's the medical legal practice we also face here in the U.S. more so than in other countries around the world. So uh, companies have to label their medication and um, explain the risk, and in some cases waiver any kind of side effects, uh, or in case of a surgery, it's not that the surgeon is bad, it's not that the surgeon is going to try to harm you, but it's just that let's weigh that responsibility because there is a small risk that we cannot control while we're going through the surgery, or while we're giving you this vaccine. And some patients say, I'm not going to go through it and refuse. And others say, okay, I understand that. I'll waive it. I'll sign it. Now I'll take the shot.
Again, the pharmaceutical companies are not protected if people just start dying from this. If there's major illness, there is culpability, there's liability involved. But if you mad because you got a little rash on your arm, I think that's a different type of situation, you know. But, we're talking about serious side effects and people dying. There is, liability there. But again, folks, we can't apply normal to an abnormal situation. This is a pandemic. This is not flu season. So if we out here thinking that we can use the same sort of mentality that we use for regular stuff in this very irregular time, the outcome is not going to be what we want.
Another question that came in is, I'll read it whole. According to the CDC, survival rate is over 99% in infected. 80% of infected are asymptomatic, which leaves 20% that have symptoms. Why would it be smart if I'm young and healthy to take the vaccine when we don't know what the long-term side effects are?
Well, I would say this to you. You should read an article in the Washington Post written by a young lady who lived with her grandmother. And her grandmother, who had been in the house the whole time, was exposed because her granddaughter came in the house and then she died. So again, you might not be the one that gets sick, but that does not escape you from the responsibility of being the spreader. So if you can take the weight of infecting somebody that you love, that has raised you. One of the brothers I know very well, his daughter was in college and his 101-year-old mother-in-law lives with them. And his daughter wanted to do regular functioning. I can come and go as I please. He said, either you're going to go to school and stay there or you're going to stay in the house. Because this game is different. Normal game, we got 3 strikes in it. COVID has changed the rules. Again, yes, we've had people that have gotten through it, but there is that great chance that you might not be that person. And do you want to be the one that takes a loved one out before they were supposed to? I was just working in the hospital a couple weeks ago. We had a couple that was admitted to the hospital. They had been in the house the whole time for COVID. A man and a wife. They've been both of them in their late 80s. Right after Thanksgiving, they got sick. And then they got sick enough where they both were admitted to the hospital, actually 2 doors down from each other because we couldn't put them in the same room. And the husband died on Monday. Later that week, the wife who was dying, she was unresponsive. Her son comes in. And, because she's dying and that is one of the reasons that we can make an adjustment with our guest policy, because we have someone who's end of life. I came in the room, you know, just to check, hey, how you doing? Is there anything I can get for you? And he said, hey, could you sit with me for a minute? And I said, sure. And then he starts talking to his mother's body, saying, I wish I would have never come over your house during Thanksgiving. So, young person, you might not get sick, but do you want to be the one that has to carry that weight right there? So, yes, it might not be something that directly impacts you, but you could unfortunately infect someone else. And that is where the damage and the result that is so devastating can occur.
So, Brother Baptiste, this question is for you. How can society risk going back to the normal if the duration of protection against COVID-19 is currently unknown?
Well, it is known. The protection is known. So we know that the vaccine is very effective for serious diseases. We know that the vaccine protects the vulnerable. So it's not just being in the field, I'm seeing it, it's also what the science is telling us. So we can choose not to believe it, but there's been extensive research done on these vaccines before they hit the market. So the Pfizer vaccines, I think they had over nearly 20,000 subjects, 15 to 20,000 subjects. Moderna had a lot of them. AstraZeneca has a lot of subjects, thousands of them. Johnson & Johnson has thousands of subjects. So we know what's the science behind it that is effective. There are unknowns for the future. We cannot project 5 years from now. We cannot project 10 years from now because there are unknowns in terms of knowing how effective it's going to be for the next 5 years. Like Dr. Phillips was saying, we might have to deal with a shot every year or every 3 years or every 10 years, like the tetanus shot. So this would be a great outcome. So in the 1918 pandemic, they were unknown. The Spanish flu, there were a lot of unknown. With the polio epidemic or pandemic, they were unknown. So we developed vaccines that tell us over time how effective they can be. So during the pandemic, you don't say, okay, we're going to wait 5 years before we open up schools. And especially when you lose over 400,000 people in less than a year, when you have 24 million confirmed infection in 8 months, 9 months. So we're living in a different time. And we have something that works now. We might not know how it's going to work 5 years from now, but we know we have the science behind it that support it strongly.
That's right. Can you go to another question on the Facebook?
Yeah, we got a question in. Let me bring it up. It's a long question. I'm going to try to paraphrase it. Basically, what the question's asking is, if it's true that the vaccine doesn't prevent the sickness and it just makes it less severe, and therefore even being vaccinated you can still get it and spread it, what's the purpose of taking the vaccine? I'll paraphrase it that way.
Well, I'm from 11369 in Queens, and the alternative in my neighborhood, because we was the epicenter in March and April, was dying. So, again, I would rather have a light flu than be admitted to the hospital and die. Now, the other part of this that's an interesting piece is this doesn't just affect COVID. It affects you if you have a heart attack. It affects you if you have a stroke, because what do you think is happening when the hospital is directing all of their resources to fighting COVID? Do you think they have adequate resources when you have just your basic heart attack or some other medical condition? That is the other place where this can be a significant situation, because it strains our resources. We have unfortunately already been taxed. You look at California, in some places in the state, they have less than 20 ICU beds available in a location. You know, that means that if you have another condition that requires an ICU bed, you might be, as they say, shit out of luck. So again, you know, it is not just COVID that you're trying to protect. It's also taking down the burden that's on the medical system. Because I'm sure if you feeling like, you know, like you having that heart attack, you want to get the best treatment possible. You don't want the B team. You don't want the C team. You don't want the no frills equipment. You want the top stuff. But unfortunately, we don't have it available because our system is being stretched to the max because of COVID. So the vaccine isn't just for directly COVID. It actually helps in other ways as well.
So now, what about people who have underlying health conditions like diabetes, lupus, high blood pressure? What are you suggesting for people who have these underlying health conditions as it relates to the vaccine?
They are more vulnerable to COVID than anything else. So the vaccines will protect them. However, if they get COVID with all these comorbidities, it is a problem. It is a serious problem because COVID virus enters the body. It affects your lungs, it affects your heart, and if you have high blood pressure, it deals with your heart, it deals with your kidney. If you have diabetes, it affects your kidneys, and COVID goes in and invade all these areas.
So will the vaccine for a diabetic, will the vaccine raise their blood sugar? And for like a person with lupus, could it affect their lupus?
We don't have that data. That data is well, for now, it doesn't exist, and they don't see it in the research.
But what I will tell you is COVID can be complicated if your diabetes ain't right. You know, again, if these other conditions are the reason why we are the low-hanging fruit. And the vaccine has been studied, including people with these conditions for this reason. Because these conditions have been, this has been the interesting thing with COVID. They have tried to use a more public health approach to fighting this virus, which means directing resources to places that have already been shown to be more vulnerable. We as people of color in the United States, we're not accustomed to being in the front of the line. We're not accustomed to somebody saying, hey, you come on, get to the front. We looking at them like, what you talking about? We always suspicious because that is our experience here in these United States of America. However, again, COVID don't give a damn about that. And again, COVID is something that's affecting those individuals that we mentioned with those medical conditions. And that is why the vaccine trials included robust samples of those people to demonstrate that there are no side effects because you're a diabetic. But I will tell you, you can die a lot more easier from COVID if you're a diabetic.
Yep.
Darryl, do you have a question from the Facebook?
Yeah, I have two questions. One, aside from getting a vaccine, what are some of the alternatives to build your immune system since people are waiting to get the vaccine?
Well, you know, vaccination and wearing a mask, that's what we know for now. In terms of a strong immune system to prevent you from getting COVID, we don't have that information. We don't have that data. We just know that we have a strain of COVID, and then now we're having more infectious strains, and that can infect people much easily, and people can get a lot sicker. We know that the vaccine would work against those strains. So far, that's what the science is telling us. However, if you're having 50% more people being infected faster, you're going to have more hospitalization, more death, etc. It doesn't matter how how strong or how weak your immune system is. If you're not vaccinated, you have a very high chance of getting it. And even after the vaccine, I mean, we've covered it ad nauseum here tonight. Even after you get the vaccines, you still need to protect yourself because it might pass you by with a runny nose, but you can bring the virus home to some extent.
So
So
I think brothers, for to the two of you, I'd like you to really answer this question in depth, because one of the beliefs is that we just keep continuously building our immune system. So if we're taking the sea moss, the elderberry, if we're drinking hot tea every day, if we're taking the immune C, if we're taking the vitamin C, everything, that we are unfortunately in our minds feeling if we're doing this, we're not getting COVID. I need you all to really get it out to the public right here that even though we're building the immune system, still doesn't mean that we won't get COVID.
Again, these things that you mentioned have not been shown statistically significantly to prevent you from getting sick from COVID. It may, it may boost your immune system and you could have a milder sort of go with COVID. But again, there's been nothing to say that it will prevent you from getting COVID. So I do elderberry, I do vitamin C, you know, I do those things and I recognize the place for that. That is to support your immune system. I think another thing that we need to make sure, because it's been almost a year now, have you gotten your physical yet? Because again, one of the reasons that we are the low-hanging fruit is because we don't stay on top of our preventive health. And unfortunately, if you're a person with high blood pressure, just because COVID pandemic's here doesn't mean your condition's going away. Just because you were told 2 years ago that you needed to follow up on your colonoscopy because you had a polyp that they found, that doesn't mean that that polyp's going to chill or not be relevant because COVID's going on. So it's still an important time to make sure that you're following up with your doctor, make sure that you're getting your annual physical, because you know the things that you need to be working on. Because again, you might need to be working on your weight. You might be a person that has some habits, you might need to be working on adjusting them. So again, I think it's important not only to think about boosting your immune system, but also think about what do I need to do as far as my overall wellness and how do I need to start a plan. It may not be a plan that's going to result in you losing 50 pounds in 2 weeks, but over the year, you might make a big difference. And again, along with possibly immuno boosting, along with these potential changes that you can make in your general health, that might be the thing that might prevent you or help you from being someone that may get COVID and prevent it from being something that's more serious. Or better yet, it may prevent you from having to go to the emergency room because you ran out of your blood pressure medicine because your doctor's office closed because it was COVID and you never thought to call him back because he's not taking any patients, even though we are working virtually and we can see patients just like we're doing this Zoom thing. These are other scenarios that can happen that can be impacted. So it's important not just to boost your immune system for now, but also to be intentional about not only your physical wellness, also your mental wellness, because we have not even talked about how significant the mental burden that this pandemic has had on us, on top of our already present stigmas when it comes to mental health in Black and brown communities. So these are all areas that need to be addressed in an intentional way so that you can improve your lifestyle, but also improve your chances of dealing with this if you were infected by it, but also preventing any other unforeseen problems that could occur.
Okay, I have a question that was posted. You're in a household with your wife and your wife was given the vaccine, but you weren't. Is there a possibility that you could get COVID?
Just as much as there was a possibility that you could get COVID before she got vaccinated.
Okay.
So again, it don't change just because she's vaccinated and you're not.
Adding to that question, but Brother Jadan, you can't get it from her because she got a vaccination.
As I said earlier, if you are catching a person that is vaccinated, theoretically can still get infected. So they could theoretically expose someone else who has not been infected with COVID.
Perfect.
So people who have COPD, like I said, the high blood pressure, diabetes, lupus, are you definitely suggesting that they get to their doctor first before they even sign up for the vaccine?
Nah. They should go get the vaccine.
Get the
I'm
vaccine.
talking about conditions where you have a specialist involved. Like, say if you have a condition that involves your immune system, you know, you should be checking in with your doctor on things like this. You know,
Okay.
if you're a person who's a transplant patient, you should be checking in with your doctor if you've had a kidney transplant. You know, again, if you had these other conditions with high allergic reaction in the past, you should be checking in with your doctor before you just sign up for it. If you're a pregnant woman, you should be checking in with your doctor before you make a decision. But if you're a person who has heart disease, you should definitely make sure you get the vaccine. I don't think it requires any, consultation to make that decision. If you're a person that has diabetes, I would definitely make sure you get the vaccine. If you're a person with lung conditions like COPD or asthma, I would definitely say, go get your vaccine.
And we know it works because patients who have these conditions were heavily part of the trials. And the vaccine doesn't show that the conditions worsen. They are all protected by getting the vaccine.
Giles, do you have one more question from Facebook? Because I have one more question from here, and then we're going to begin to wrap this up.
Hey, you should do your questions first. Let me go through the Facebook questions again.
So basically, who created this vaccine? That's one of the questions in the chat was who created the vaccine?
Well, the technology, if we've been paying attention to the news, is a young sister who's a graduate of University of Maryland, Baltimore County. She's a part of the Meyerhoff program, which is one of the more prominent undergraduate programs producing Black and brown healthcare professionals. So she comes from a great track record.
Okay. Giles, you have a question or no?
Oh, no, we're good to go.
We're good to go? Okay. Basically, I just want to turn it over to the both of you for your final last thoughts. Brother Phyllis, brother Jean Baptiste. Just one last thing to everyone that's on here, and then we will wrap this up. So, Brother Baptiste, you want to go first?
Yeah, sure. Folks, thank you for your support. Thank you for coming out tonight to be part of this, to share your ideas with us, to share your fears, your concern with us. We are here to share with you what we know. We select this profession to be a men of service. And that's what we're doing here tonight. To let you know what's out there, to let you know what we know, to let you know what can work out, what's not so strong at working out, but what we have that can protect us and protect our communities. We all have a responsibility toward ourselves and toward our loved ones, toward our friends, the schools we want to go back to, the churches we want to go back to, the restaurants we want to go back to. We all have a duty, a responsibility toward those places and towards the people who frequent those places. This is the time where we all need to think of the future. This is the time where we need to think of ourselves, not just in terms of taking the vaccine or not taking the vaccines, but in terms of what can make us all healthier. I think right now what we're dealing with, we might sit here and think about the choices that we have, but we also should think about those we have lost. We will be approaching 500,000 deaths in no time. In the next month and a half or 2 months, we will be approaching about 500,000 deaths because of COVID-19. It's a big number. We'll only be approaching 30 million people being infected. It's a big number. Those are recorded numbers. We don't know in the early days of COVID, people who died from COVID were not tested, and people who got sick and recovered were not tested. So please think of your loved ones, think of the people you work with, think of what your responsibility is towards each other, and get vaccinated. That's the best way I can put it. It protects you against a lot of things. Keep your eyes on yourself. exercise, eat well, do all these other things that you're doing, take your vitamin C. But keep in mind that we are in a pandemic time and there are other things that we must do to keep each other safe.
Thank you, Brother Phillips.
Thank you for the opportunity. Great partnering with yourself and Watson as far as getting this information out. Again, I just want to say, this is for the purpose of us all developing our skills and becoming COVID ambassadors. I think one of the things we have seen thus far is that there's a lot of mistrust, there's a lot of misinformation, but what we've also seen is that we trust certain people in our community. And it doesn't always have to be just the doctor. It could be the person that owns the corner store. It could be the pastor at the church. But all of us have the ability to help. And the help that I'm talking about is we need to be part of this messaging that gets out to our community. Because one of the things that we're seeing of all of the industrialized countries in the world, we have one of the lowest vaccination rates thus far. So again, everybody banking on that herd immunity, we may not be reaching that for some time, especially if we're not getting vaccinated. And what I'm finding is that a lot of our reasons are not even based on sound science. Another thing that's become quite apparent is the technology, at least as far as the process for applying for the vaccination, is not always easy to use. And when we talk about the vulnerability of our elders, a lot of our elders don't have the ability to do a Zoom meeting. So how are they going to get on a website and sign up and make an appointment for a vaccine? So maybe if it doesn't apply to us, maybe we need to go check on grandma or grandpa or auntie or uncle so-and-so and see if they need some help to sign up. Because again, folks, as I said earlier, we are entering the darkest times of this. We are seeing the results, unfortunately, of not staying in the crib. As I said earlier, a majority of the cases that we're seeing now are because of people stepping out, social gatherings. And I understand because this COVID fatigue is real, but actually COVID don't give a damn if you're tired, if you're accustomed to hanging out with your family for New Year's, if you're accustomed to seeing your grandkids, with certain frequency. COVID don't care about any of that. So again, folks, not only consider strongly the vaccine, but also take this information and give it to those in your community, in your village that need it, to those that don't have the access to getting on this Zoom meeting, who don't have the skill sets or the technology to use the state Department of Health website to use the vaccine portal. These are all ways on top of what we've been doing that can be supportive, because again, if we do not change anything, what happens to low-hanging fruit? It keeps getting picked. And we're going to keep getting picked off by this COVID pandemic if we do nothing. So again, folks, thank you very much. Please continue to wear your mask. Please continue to practice all of the other safety precautions. And if you feel that you have an issue to be concerned about, I'm not feeling well or I was around someone, testing is much more available than it's ever been. Get a test. As I said also, make sure you're in touch with your doctor, because there are therapeutic remedies that are helpful, but it all matters if you're connected to a medical doctor, because if you're not, you might not get it. And the lack of those things could be the differentiator from you getting better or not. And last but not least, let's make sure that we are intentional about our mental and spiritual wellness. Let's make sure we are intentional about checking on those that have suffered and that are isolated because of things beyond their control because of this pandemic. So again, thank you very much and God bless.
So I just want to thank the both of you for sharing your knowledge, sharing your time. This was very informative, very much needed. So everyone that's on here, I thank you on the behalf of Sigma Beta Beta of Omega Psi Phi Fraternity. Before I turn it over to our brother Basilis, just definitely the fact that we need to make sure we get this word out. So this was done on Facebook Live that can be seen constantly. It could just, all you have to do is go to Sigma Beta Beta page of Omega Psi Phi on Facebook, and you can see this as well. We're trying to reach as many people as possible by doing these. I see a lot of brothers on here that I know. I got my family on here. So when this hit, I'm tired of putting on the white gloves. The brothers over Omega know what I'm saying. I'm tired of the white. I can't do this no more. So we have to make sure that we are getting the knowledge that we need about this COVID. So, Brother Bastos, I'm going to turn it over to you. For those of you that are in the chat that I didn't get to your question, I tried my best to do as much as I could with your questions and condense it and ask it. But I really want to thank Brother Phillips, Brother Jean Baptiste. Thank you so much. Brother Rattray, I'm going to turn it over to you.
Thank you, Brother Rivers. And just another huge thank you. Right now, it'll be a round of applause for our expert panelists, Brother Dr. Jadam Phillips, Brother Dr. Watson John Baptiste. Thank you for your work on this. Thank you for the panel. Thank you for being real and honest with everyone that asked questions and were a part of it. Brother Rivers, thank you for being such an amazing host and moderator and navigating all the questions that came in. And of course, behind the scenes, we have our tech folks. So Brother Jeffrey Sealy and Brother Jaquan McCall, thank you for making this happen. Thank you for making sure it got on Facebook Live.
Absolutely. Yes.
Thank everyone that showed out for this evening. Please, as Brother Rivers mentioned, follow us on Facebook at Sigma Beta Beta chapter of Omega Psi Phi Fraternity Incorporated. And on Instagram, we are actually at Sigma Beta Beta 1983. That's our Instagram handle. We'll post videos both on Instagram and the entire video on Facebook. So
and please share. We need you to share this. Please share this with as many people. Right as we're about to end, I'm going to ask for the brothers of Omega to please stay on. If you can just stay on for 5 more minutes, we just want all the brothers to stay on as other people start to exit out.
All right. Thank you for coming out. Have a good night. Brothers, stay on.